Hi, let me explain you in this video mean arterial pressure and how to calculate it. Mean arterial pressure is defined as the average pressure in a patient's arteries during one cardiac cycle. It is considered a better indicator of perfusion to vital organs than systolic blood pressure. True mean arterial pressure can only be determined by invasive monitoring and complex calculations. However, it can also be calculated using a formula of the systolic blood pressure and the diastolic blood pressure. On the right side, you see one of the cuffs with monitors that can be used for measuring blood pressure without stethoscope. There are several clinical situations in which it is especially important to monitor mean arterial pressure. In patients with sepsis, vasopressors are often titrated based on the mean arterial pressure. In the guidelines of the Surviving Sepsis campaign, it is recommended that the mean arterial pressure be maintained more than 65 mm of mercury. Also, in patients with head injury or stroke, treatment may be dependent on the patient's mean arterial pressure. So, in the normal range, mean arterial pressure could vary from 50 to 150, and more than 65 mm of mercury is considered normal for perfusing adequately organs, vital organs especially. And so what is the formula for calculating this mean arterial pressure? So on this monitor you see up 123, it is a systolic blood pressure, and on below it is 79, it is the diastolic blood pressure. And knowing these two numbers, we can calculate mean arterial pressure. So there are many formulas like mean arterial pressure equal to diastolic pressure plus 1/3 of pulse pressure. Pulse pressure is equal with difference between systolic blood pressure and diastolic blood pressure. For example, if systolic blood pressure is 120 and diastolic is 90, blood pressure or pulse pressure is around 30. Another one is mean arterial pressure equal with systolic blood pressure, or 1/3. It's equal with 1/3 of systolic blood pressure plus 2/3 of diastolic blood pressure. Another one is cardiac output multiplying with or timing by systemic vascular resistance and plus central venous pressure. And the last one is 1/3 of systolic blood pressure minus 1/3 of diastolic blood pressure plus diastolic blood pressure. So if we are using normal blood pressure 120/80 and put every of these numbers in formulas, we have the same number. So number is 100. So let's go with this one. Diastolic blood pressure is 90 and systolic blood pressure is 120. So diastolic blood pressure 90 plus 1/3 of pulse pressure which is 30, and we have 90 plus 10 is 100. Another one is 120 plus 2 times of diastolic blood pressure divided all of them to 3. So 300 on 3 is 100. Any of the formula in use result at the same number. Thank you very much for your attention. Hope this video is useful for you and helping in solving such formulas and calculating of mean arterial pressure.